Imagine you're living an active, normal life. Over the course of a couple of years, your eyes mysteriously start to droop and you lose the ability to hold your head up or talk. Those are some of the symptoms one woman experienced living with a rare I can't even talk again, autoimmune disease called, that's right, myasthenia gravis. Here now to talk about her diagnosis journey and the importance of advocating for yourself is Shanaz, who lives with this generalized disease, MG. Joining her is Dr. Sahid Badoon to explain more about this rare disease. Good morning to both of you.
Good morning. Good morning, James.
Morning. Doctor, what is MG and more specifically, what is generalized MG?
Yeah, well, great. Myasthenia gravis is a rare autoimmune disease that affects the neuromuscular junction. The neuromuscular junction is the area where the nerve and muscles meet, and that's where electrical signaling happens, leading to chemical signaling and then muscle contraction. In myasthenia gravis, there is an autoimmune attack against the neuromuscular junction. In collaboration with UCB, I'm here to raise awareness about myasthenia gravis. A form of myasthenia gravis is called generalized myasthenia gravis, or GMG, and that can practically affect all skeletal muscles in the body, which include the eye muscles, the muscles of speech, chewing, swallowing, breathing, neck muscles, arm and leg muscles. So symptoms do vary, do fluctuate. One characteristic things about myasthenia is the fatigability and the fluctuation of the muscle weakness, particularly the change during the day or even from day to day. It's diagnosed clinically, validated by an antibody, a blood diagnostic study.
Shanaz, if I hope I'm saying your name correctly, can you tell us about your general MG diagnosis and treatment journey?
My journey began in 2022 when I started experiencing symptoms including double vision, slurred speech, and fatigue. I thought I was just overworked or stressed. My doctor diagnosed me with reflux, but I knew that was wrong. It was frustrating and I felt unheard as my symptoms worsened. I was in Rome when my symptoms escalated drastically. I lost the ability to smile, to speak, to swallow, to chew, and it was really scary. I hurried back home and I went to see different specialists until I saw my neurologist who diagnosed me with myasthenia. Initially, I was treated with steroids, which helped with some symptoms but did not address the underlying condition. I was determined to find the right treatment for me, and I researched extensively and worked with my neurologist to start the treatment I am on today.
Now, doctor, what can you tell us about treatments for the disease?
Well, the treatment, no two patients are exactly the same. With myasthenia, it's very important for the doctor to tailor the treatment to the patient. And there is a treatment that addresses the symptoms of myasthenia, but the more important treatment is to address the autoimmune aspect of the disease. In the last few years, there have been major advances in new therapeutics for myasthenia, what we call targeted immunotherapy. One such medication is called Restigo. It works by blocking a protein in the body called the neonatal Fc receptor that extend the half-life of harmful antibody. And the benefits can be appreciated after taking Restigo. Patients need to discuss with their doctors what kind of benefit they get, as well as if they have any particular side effect. And it's very important to discuss this with the patient, to discuss it with the physician.
Shanaz, do you have any advice for others living with generalized MG?
For me, living with myasthenia is like a slow roller coaster. It's important to have the right treatment. For me, this treatment makes a difference in my day-to-day life. Being able to focus on my kids and work is very important. Advocating for yourself, trust your instincts, and persevere in seeking answers, and also build a strong relationship with your doctor is the key to effective treatment.
You know, Shanaz, I like everything that you just said because what really stood out to me was you were telling me that the first doctor was not listening to you. Talk a little bit about that.
I think it's because, I mean, it would be a question for Dr. Baidoun, but for me, I think it's because it's such a rare disease. I went to see my general practitioner, and until they were able to kind of see the actual effects, my symptoms, they weren't able to kind of direct me to the appropriate doctor, to the appropriate specialist. And when they did, hey, I was able to get the diagnosis that I needed.
Doctor, what final takeaways would you like to share with our audience? And it's particularly what she just said.
Well, Shanaz said it correctly, and she said sharing with the doctor listening, and because of that, the diagnosis can be missed if they don't listen correctly. So it's very important to develop that relationship with the doctor. Websites that are available for patients with myasthenia to go to would be MGFA, Myasthenia Gravis Foundation of America, or myasthenia.org, or another website called restigo.com.
It seems like to me, Dr. Shanaz, that the main thing is to make sure you communicate with your doctor. That's one of the most important things that you must do is communication. Is that correct?
Yes, for me, it was vital in my diagnosis.
Okay.
It's very crucial, very crucial.
Very crucial. Dr. Shanaz, thank you so much for joining us on Morning Blend. This is a very interesting disease we talked about today. Thank you so much for joining us on Morning Blend.
Thank you for having us.
Thank you, James.